Hello and welcome to the COVID-19 update on Channels Television. I'm Millicent Walker. First, the highlights. The governor of Jigawa State, Badar Abubakar, and his aides take the COVID-19 booster shots. Taraba State to put more effort behind sensitization and observance of non-pharmaceutical safety measures against the virus. And United States government says it is not shutting down even though COVID-19 infections are spiking. Thank you for joining us. According to the Nigeria Center for Disease Control (NCDC), public sector leaders and business owners have a role to play to help stop the spread and upsurge of COVID-19. This is as the surge in coronavirus infections continued last night, with Nigeria recording over 1,000 additional cases reported from 10 states of the Federation and the Federal Capital Territory. Here's a report on the pandemic update.
1,051 additional persons in Nigeria have tested positive to COVID-19 in the last 24 hours. According to the Nigeria Center for Disease Control, the latest figures were reported from 10 states and the FCT, indicating a drop from the figures reported 24 hours earlier. Lagos had the highest number of infections with 599 cases. The FCT was next with 238 cases. Rivers recorded 79 cases, Oyo had 51, Ondo had 32. Plateau State recorded 20 cases and Akwa Ibom recorded 11. Ogun had 7 new infections. Bayelsa and Kano both recorded 5, and Kwara brought up the rear with 4 cases. The new tally has increased the total confirmed cases in Nigeria to 221,071. The report also includes 0 cases from Bauchi, Ekiti, Osun, and Sokoto states. 53 patients have been discharged in the last 24 hours, increasing the total number of recoveries to 211,345. There were no additional deaths resulting from COVID-19 complications in the last 24 hours, leaving the fatality toll at 2,983. Currently, there are over 6,000 active cases in Nigeria, while over 3.6 million samples have been tested so far. More than 8.3 million eligible Nigerians targeted for COVID-19 vaccination have received their first dose, while over 4 million persons have been fully vaccinated. In Africa, there are more than 8.9 million confirmed cases and over 225,000 deaths have been recorded across countries on the continent. The total global confirmed cases have surpassed 272 million, while deaths are beyond 5.3 million.
Governor Badar Abubakar has urged the people of Jigawa State to take the booster dose vaccine against the COVID-19 virus. The governor made the statement while addressing newsmen after getting his booster shot. According to him, the booster is an additional protection against Omicron and other variants.
These vaccinations now, with the new variant, Omicron, it is very, very, very important for people to really take the booster dose. And those that have not taken the vaccine should endeavor to do that. As you have seen across the world, this variant transmits rapidly and faster than the previous variants. And if you have not taken the vaccine, there is possibility of serious sickness and even death. So it's really very, very important to take the vaccine so that our people will continue to be open and continue to do their businesses. As you have seen, some of the even major economies are locking down, are bringing back restrictions. We don't want to get to that. If you take the vaccine, we are sure that you will be less sick. Hospitalization rate will be very, very low, and deaths will be certainly very, very low.
Meanwhile, the Permanent Secretary, Ministry of Health, Dr. Salisu Mwazu, gives the total figures and updates of vaccinations carried out so far in the state.
As of today, we vaccinated about 326,000 people, those who have received their first dose, and about 63,000 people that have received their second dose. Here we are today, we have commenced the booster dose. So this signals the commencement of the third dose. And the rationale behind giving this third dose is to booster the immunity. Research has shown that after some time, the second dose of COVID-19 wanes away.
And to Taraba State, where the government says it will not allow for community transmission of the new variant of COVID-19 in the state in view of residents' attitude towards the ongoing vaccination exercise. According to the Executive Secretary, Taraba State Primary Healthcare Development Agency, Aminu Hassan, the state government is not buying the idea of enforcement, but will continuously advocate and enlighten its residents on the dangers involved in contracting COVID. He says that insecurity and the difficult terrain of the state remains the bane for the overall vaccination, stressing that the Primary Healthcare Development Agency is working towards supporting the state's agency to complement the efforts.
I want to assure the good people of Taraba State that the agency, in collaboration with the Ministry of Health, will continue to do its best to ensure that at least no person is left behind without taking the vaccines. But even as we continue to give the vaccination, I want to crave the indulgence of our people to continue to maintain the social distancing protocol, using the face masks, washing of their hands, so as to ensure that we protect ourselves and our loved ones. Well, the truth of the matter is I am more than worried because of the simple fact that I knew quite all right that the pandemic is very severe and it's very deadly. And if you allow it to continue by way of community transmission, definitely is not going to tell well on ourselves. And having said that, I want to believe that for us to achieve total protection for individual and then the community at large, each and every one of us have a role to play. It will not argue well for government to continue to insist in enforcement. We want our people to look at their own surroundings, look at what is happening in other countries, and at least have a change of attitudes and have a change of mind. And also believe in the simple fact that this virus is real, the pandemic is real, so that individually we'll also play our own part, because the protective nature of what we're expected to do, it has no any cost element. So why should we not at least adhere to those social distancing protocols for the simple fact that we protect ourselves and we protect our loved ones? This is a question that is yearning for answers.
Well, Omicron and Delta may strike people at the same time and combine to create an even worse COVID variant in the coming weeks. Moderna vaccine maker's chief medical officer, Dr. Paul Burton, has warned. He says this new super variant could be created if Omicron and Delta infect someone at the same time. COVID infections are said to normally only involve one mutant strain, but in extremely rare cases, two can strike at the same time. Well, joining us to talk more about this is Dr. Ganu Jamiu, who's a public health physician. Thank you for joining us on the program.
Thank you very much. Good evening.
All right, Doctor, do you agree with the Moderna chief, the Delta and Omicron combining to form yet another variant?
Well, there's nothing possible in medicine, and looking at the evolution of the virus itself, it's possible that it's not impossible, because as we all know, the virus keeps on mutating. We started with Alpha, we got to Delta, currently we are talking of Omicron, so it's likely, there's nothing impossible in medicine. It's possible it can actually happen, and following that, anything can still happen. Yeah, I agree with you.
But also, you know, people are wondering if this has ever happened before in terms of the combination of viruses. I mean, some experts have said that the Alpha variant seems to be a recombination of the B.1.5 and another virus together, but then after a number of days, it disappeared.
Well, as I've said, there is not, you can't actually predict. One thing we need to understand is that what is happening as regards to variants of concern is that it is an adaptive process among microorganisms, even the bacteria. So what they do is that what the virus is trying to do is to continue to survive, and that is why the virus is devising every method to see that it defies every measures, especially with the use of vaccines and so on, to make sure that they keep a kind of multiplying and keep on, causing infections among the susceptible individuals. Yeah.
So, with all of this happening, what are the chances of this happening in Nigeria? Some people have said that, should we in Africa handle the COVID-19 differently from our Western brothers? And this is based on what we see of the epidemiology on our part.
Well, I just want to clear something before I respond to your question. Preliminary studies have not really shown that the Omicron variant it can cause more infection. That is, it has tendency to cause higher more infections from one person to the other. And it has also not been shown that it can cause severity of infection. There are still a lot of studies still going on. The only thing that is available based on recent finding is the fact that giving a third dose, a booster dose, we ensure that there is a kind of protection of vaccine against the virus. So all these speculations, there has not been any data to actually verify whether the ongoing transmission or increased number of cases globally is as a result of Omicron. No, it has not been actually established. So for us to start speculating and saying that this is what the virus is causing, whatever, I don't think there has been any evidence as regards to that. There is still a lot more need to be learned about it. And by the way, globally now, we barely have only a total number of about 10,000 number of Omicron cases globally, with about roughly 2,000 plus in Europe, and the rest of other countries having about 7,000. So there is still a lot that needs to be known about the virus. But the key thing I will say is that our approach will not vary from what we used to know. The only thing is that we should not lose our guard. And based on available evidence, we need to keep on with surveillance. That is our enhanced surveillance. And apart from that, again, we need to also step up our genomic surveillance, that is sequencing, ensuring that those data are feed into the WHO database so that can inform decisions. But and one other thing I just want to say again is that please, irrespective of where vaccination is very important to a kind of protection against the virus, we still need to maintain the non-pharmaceutical measure, which is very, very key. Because for now, the vaccine can only protect against severity of infection and likelihood of hospitalization. But issue of transmission from one person to the other, I don't think it can be achieved at now, because for us to get to that level, we must have achieved a global herd immunity of at least 70% of the world being immunized. So that's just the point I want to mention. Thank you.
But also, that is also questionable in the wake of the Omicron variant and what we're learning from it. But we always appreciate your time on the program. Thank you. Dr. Gani Ujemi is a public health physician. Thank you for joining us. In the meantime, United Nations Secretary General Antonio Guterres is calling on all countries to work in a coordinated way to defeat COVID-19. He made his appeal during his end-of-year press stakeout when he addressed the deficits and the governance of both the pandemic and international financial system. According to Guterres, the COVID-19 is not going away. However, he stresses that the world cannot defeat a pandemic in an uncoordinated way.
The strategy of vaccine hoarding, the strategy of vaccine nationalism, or the strategy of vaccine diplomacy have failed. This new variant has demonstrated this failure. And so my hope is that countries understand that from now on, we need to have an equitable way to address the pandemic, or we will all be victims of it.
According to the director of the Center for Infectious Disease Research and Policy at the University of Minnesota, the coronavirus will hit millions of Americans in a viral blizzard within a few weeks as infections from the Omicron variant pile on top of Delta. Already, hospitalizations are rising as the holiday season gets into full swing. And long lines for COVID-19 testing formed Thursday in metro areas including New York, Boston, and Miami. But in spite of the spike, the U.S. government is saying that it will not shut down. Our Washington correspondent Maria Bird has more.
With the melody of peace.
The United States Congress marked the 800,000 death mark due to COVID-19 with a candlelight vigil at the U.S. Capitol. The Omicron variant sweeps through the U.S. as the country has reached the highest hospitalization rates since last April. Despite the very aggressive spread of the virus, Dr. Fauci states that an Omicron-specific booster will not be necessary.
The Omicron variant undoubtedly compromises the effects of a 2-dose mRNA vaccine-induced antibodies and reduces the overall protection. However, as I showed on a prior slide, considerable protection still maintains against severe disease. The early in vitro and clinical studies that I mentioned indicate that boosters reconstitute the antibody titers and enhance the vaccine protection against Omicron. And so finally, our booster vaccine regimens work against Omicron. At this point, there is no need for a variant-specific booster.
While COVID-19 is one of the greatest health risks around the world, the U.S. Senate recently passed the bill to overturn President Biden's vaccine mandate.
Does any senator wish to change his or her vote? If not, the yeas are 52, the nays are 48. The joint resolution is passed.
So how on earth does it make sense right now to undercut one of the strongest tools that we have to get people vaccinated and stop this virus?
The federal government has no authority to make anyone choose between getting a vaccine and keeping their job.
U.S. vaccination rates continue to increase for Americans over the age of 5. But colleges and offices are still being forced to shut down due to COVID-19 outbreaks that are being spurred by the Delta and Omicron variants. From Washington, Maria Bird, Channel Television News.
And away from the U.S., it's more predictions as 3 of Germany's top researchers are saying that it's only a matter of time before Germany sees a full force of Omicron infections, a case of not if, but when. During a virtual nationwide press briefing recently, they predict that infection rates will shoot up dramatically, possibly to hundreds of thousands per day. Now, that dark prognosis is based on international data that German researchers have been studying. So, well, to take a look at some of this things happening around the world. Joining us right now, Deutsche Welle correspondent Christy Platzen. She joins us from Berlin. Hi, Christy. I mean, high infections looking at Germany last year led to some parts of Europe restricting the number of people that could gather together for the holidays. But are we going to see similar measures again this year?
Well, we're seeing a real mixed bag reaction from European policymakers, though there is a common denominator there that there is definitely a sense of nervousness about what the Christmas holiday could bring. If we want to zoom in a little bit and take a look at a few examples, in France, we've just heard they'll be tightening restrictions for people coming from the UK. That country is seeing their highest infection rates since the pandemic began. Their health authority has encouraged people indeed to reduce their contacts with each other over the holiday. And and word on the ground from there is that people are respecting this to some degree. Pubs, restaurants have reported that people are calling in to cancel reservations they've made, cancel Christmas parties that had been planned. We could also take a look at an example out of the Netherlands. They've been in a partial lockdown since November, trying to get a hold of a wave caused by the Delta variant there, and now they have opted to close primary schools a week early with fears that the Omicron variant could lead to a similar wave. Now, if we look at Germany here on the ground specifically, we have restrictions in place for states where infection rates are very high. In those states, no more than 50 people are allowed to gather together indoors, and those individuals must be either vaccinated or recovered from the coronavirus. And we also have the new coronavirus advisory board to the new federal government recently coming together for the first time. They also plan to meet again and issue their recommendation ahead of Christmas next week. So we should be hearing from them in the next few days. And they have said that they will be respecting the scientific data, or taking that into a greater account, I should say, than has previously been the case. And if this means taking quote unquote radical steps, they are willing to do so. So what this means for Christmas at this point is hard to say.
This is also an important month revenue-wise for many businesses. Are rising infections causing any issues there?
Well, we have heard major complaints from retailers that current restrictions in place have really hit their sales. Currently in Germany, people who are not vaccinated or recovered from the coronavirus are not allowed to go into certain stores. These people are, of course, allowed to go to stores that serve their daily purposes, like grocery stores and pharmacies, for example, but they are not allowed to go into shops that sell clothing, for example, sell electronics, the kind of places people do tend to buy Christmas gifts. And so this is, of course, a very significant factor this December for retailers. Interestingly, we saw in Lower Saxony this week a court ruling that these restrictions are illegal. According to this court, they say that the restrictions are not slowing the spread of the coronavirus, and they do not respect the principle of equality as is understood here in Germany. There are similar lawsuits pending in other states around the country. It will be interesting to see which way those courts decide, but this decision out of Lower Saxony at least shows that the restrictions are at least questionable.
Finally, Christy, how does Germany plan to get this latest wave under control?
In a word, vaccinations. I mean, since the new government took power a few weeks ago, we've really seen a shift in tone about vaccinations, a lot of momentum pushing there for people to go get their shot. And we're seeing this both in terms of the rhetoric they're using and also in terms of the policies they're considering. We heard from the new German health minister that there's something like 70 million shots that still need to be distributed. This is a mix of both booster shots for some people, as well as people still needing the first or second coronavirus vaccination. And a bit of bad timing there, just as there's really a big push for this vaccination campaign. Word has come out there is actually a shortage of vaccines available in Germany right now. With the current orders in place, there would not be enough vaccines to cover this many shots until March. So this is, of course, too slow. So Germany's health minister has said they have put in a massive order for more vaccines from BioNTech, the German vaccine developer that has worked on developing a vaccine with Pfizer. There's also European mechanisms that will be at play to hopefully get vaccines to Germany sooner than March.
Thanks, Christy. I think I'll see you next on Christmas Eve. Deutsche Welle correspondent there with us from Berlin. Russian President Vladimir Putin says the country's Sputnik V5 coronavirus vaccine is effective against the Omicron variant. Well, here's more on the global update.
South Africa's health minister says the government believes that vaccines and high levels of prior COVID-19 infections are helping to keep the disease milder in a wave driven by the Omicron variant. There have been early anecdotal accounts suggesting that Omicron is causing less severe illness than previous variants in South Africa, but scientists say it is too early to draw firm conclusions. The country reported a record number of daily infections earlier this week.
So we believe that it might not necessarily just be that Omicron is less virulent, but we believe that this coverage of immunization, of vaccination, but also in addition, natural immunity of people who have already had contact with the virus, is also adding to the protection. That's why we're seeing mild illness.
Over in Germany, the health minister says he expects the Omicron variant of the coronavirus to unleash a massive fifth wave of the pandemic. He says Germany has to prepare for a challenge officials have never seen in this form before. It comes as the country reported an increase in the number of Omicron infections, according to a weekly report from the country's National Disease and Control Center. Officials say pressure on French hospitals has been steadily mounting over the past weeks as France battles a fifth wave of COVID-19 infections, which has been filling up ICUs with unvaccinated patients. France recorded 60,866 new cases over the past 24 hours. The government had said earlier in the week that it expects to see around 4,000 patients in intensive care with COVID-19 by the Christmas holidays. Australia's New South Wales has set another daily record of 2,313 COVID-19 cases as infections surge across the state. The state has broken its own record for news for the second day in a row, with infections jumping from Thursday's total of 1,742. A raft of restrictions have been eased across the state this week. Masks are now only required on public transport, at airports, planes, and for unvaccinated indoor hospitality staff. And finally, Russian President Vladimir Putin says the country's Sputnik 5 coronavirus vaccine is effective against the Omicron variant. He says data shows the vaccine induces a robust neutralizing antibody response to the Omicron variant, which is further strengthened by the Sputnik-like booster. Sputnik 5 is one of Russia's 4 domestically approved COVID-19 vaccines.
You can visit our websites for more updates, also a better understanding of the pandemic. You can find some breaking news. It's all at your fingertips on channelstv.com. That's our program for the week. Thank you for watching. I'm Melissa Tuwaka. Stay healthy.